Did you hear that? Hi, everyone. I always do that, don't I? Thank you so much for joining us today. It's Melissa from the Parent Collective, and we've also got the lovely Sara from Norwalk Midwives today. Is it Norwalk Midwives? Norwalk Hospital Midwives?
Norwalk Hospital Midwives, Norwalk Hospital Midwifery Service. We
Okay.
go by all kinds of names.
Okay. I wanted to tell you guys a little bit about us today, because I know I normally just do a very brief introduction, but I'm Melissa from the Parent Collective, and what we do is we do prenatal classes that organises everyone by their neighbourhood and due date. So it's an English idea. It's been going in England for like 60 years, and the idea is that you build those bonds and those friendships before the babies arrive. So we're currently in Westport, in Fairfield. We're just about to launch in Greenwich, which is super excited, and we're also in Tribeca as well. So welcome. Thank you, Sara, for speaking with us today. We've been so looking forward to speaking to you because we have so many mums that come to our classes and they've always wanted to do midwifery care, but they've never really understood what it is, where it would fit in with their delivery and that type of thing. So I've got some questions for you today that they've given us, so I hope you don't mind. I'm going to throw those questions at you if that's all right. So what is a midwife?
So a midwife, one of the reasons that it's so confusing for families and for women is that there are many definitions depending on where you are in the world, where you are in the country.
Right.
Even within the United States, there are different types of midwives.
Oh, really?
So
okay.
we could be talking about certified professional midwives, which are more the traditionally apprentice-trained midwives, and they are, I think, what people think of when they think of a midwife. They do mostly home births.
Right.
The majority of midwives in the United States are actually, like me, are certified nurse midwives, or certified midwives is another small percentage, who actually do most of their care within the hospital healthcare systems.
That's like the ideal situation, isn't
Right.
it? Because then you get the midwifery care, but you also have the backup.
Exactly.
In case there's ever an emergency.
So we, as certified nurse midwives, provide what we call full scope midwifery care, which is, what you think of for a midwife care surrounding childbirth. So we do prenatal care, attend births, deliver babies, as people might say.
Yeah.
We don't like to say that. We say we attend the birth because the
Right.
woman is delivering the baby
That
into
makes
the
sense.
world.
Yeah. Yeah.
Postpartum care, but we also do, annual GYN visits and pap smears and, breast cancer screening and contraception.
So you do full care for
Right.
for the woman.
Right.
That's amazing.
So
I
it's
never
a
knew
lot
that.
more than people think about when they think about a midwife. So we hear from a lot of women like, oh, I don't need a midwife. I'm, past that stage. I'm menopausal. And anybody could use a midwife.
Oh, that's amazing.
And we work in collaboration with OBGYNs and specialists. So if there's something outside the scope of what we can provide, then we refer and we co-manage, things like that. So we typically do everything you think about your OBGYN except for the GYN surgeries.
Right. But you're just much more hands-on. I assume, do you have a little bit more time than an OB? Because I feel like you go to see your OB, you're in and out within about 7.5 minutes. It's that literal feeling of like bang, 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 bang.
Yep.
Whereas I always feel like a midwife is a little bit more caring. You guys are a bit more hands-on, a bit more understanding of the emotional needs of the mum as well as the physical needs.
Right. So the origin of the word midwife is German. It means with woman.
Right.
And I think that that's a really accurate way of describing midwifery care, is that we are there to be with you in whatever stage of life you're in, to help you address your needs and to make sure that you are in the optimal place.
Yeah.
So we want to spend that time kind of listening and figuring out, where are you? What do you need from us? What can we help you with?
Yeah.
So I think that our appointments in general have a lot more time dedicated to listening and understanding the problem and providing education.
That's fantastic. What's the difference between a midwife and a doula?
Yep. So a lot of people wonder about that too. A doula is a labor support person.
Right.
And they provide amazing services. I think they can be invaluable for many, many people. They don't provide the actual prenatal care.
Right.
They don't deliver the baby.
Yeah.
They're there purely to emotionally and physically support the mom during labor.
Oh,
and they're usually one-on-one, don't leave the mom's side.
Yeah.
And also for her partner. Because not only does the laboring woman need support, her partner needs support.
Yeah, that's right.
Some people say, I don't need a doula because, I don't want them to take over the role of my support person, but they support the whole family.
They support both.
So we often provide a lot of that similar support. I like to be present in the room as much as possible when I have a laboring woman with me at the hospital, but I might have other clinical responsibilities as well. So it is important to me that the woman is comfortable and coping well, but if it's a matter of, addressing a problem, that's got to be my main focus.
Of course.
I have to make sure mom and baby are safe.
Of course.
And then I make sure they're comfortable.
Yeah, of course.
Whereas the doula is just there for comfort.
And actually, for me, that's my priority too. I need to be sure that my baby's okay and that I'm okay, like health-wise, and then the emotional needs, comes very quickly afterwards, but that sounds like the right order to me. So,
and the training is different. So a doula a doula goes through the DONA certification or whatever pathway. We have medical training and board certification and things like that.
Right. And so, what is the difference then between you working with an OB and working with a midwife? Because I think you've kind of covered that off, but explain to everyone how that works then.
Right. So one of my fellow midwives, Esla, who works with our service, coined the phrase experience the difference. And I think that it's really a matter of difference. So philosophically, there are differences between midwifery care and obstetrical care. Midwifery feels that pregnancy and birth are very physiologic processes that we've evolved to do and that we're supposed to do and that they are healthy things. Understanding that there can be complications and needing to be able to recognize those complications, but feeling like this is normal until proven otherwise.
Right.
Whereas obstetrics comes from the opposite point of view, where they say every labor is abnormal until the baby's out and everybody's healthy, and then we know that it's abnormal until proven normal.
Right.
Whereas we come into it, it's normal until proven abnormal. So philosophy is one way that it's different. I think amount of time that we spend is different. So in terms of your actual visits, we usually spend between around 30 minutes or so for a prenatal visit.
That's amazing.
I think a lot more in-depth education during that time. And during the labor, we are physically present a lot of the time. So if you're working with a traditional obstetrical practice, the nurses at the hospital are going to do a lot of the management, a lot of the care. And we, because we are nurses and midwives, take on a lot of that nursing role as well.
Right.
So
I bet they love it when you turn up. I bet they're like,
yes. Yep. And we work really well with the nurses because they enjoy that extra support and company.
Yeah, absolutely. And I think there's definitely room for both. I think there's definitely room for people that want the more sort of traditional methods of kind of knowing that it's a doctor really that's looking after them, or an obstetrician, or someone that is a bit more hands-on. So there's definitely room for both, isn't there?
Yep.
The last question that I wanted to ask you, actually, let me just quickly check my notes because I want to be sure that we haven't forgotten anything. So people actually wrote in to ask these questions. Oh, yes, I love this. Can you have both? Mm-hmm. Can you have an obstetrician and a midwife look after you at the same time?
Right. So the answer to that also varies depending on where you are in the country and what your individual practice is like.
Right.
In general, midwives practice within the system.
Okay.
So, nobody is an island. Nobody's isolated. We provide care in collaboration. So, even midwifery practices that are completely solo and independent have obstetricians that they co-manage or refer to for certain problems.
Yeah.
At Norwalk Hospital, I think we really have the best of both worlds because we have our private practice where we care for you and you see the midwives. We get to know each other. There's always one of us at the hospital. So always one of your midwives is going to be present. But we also have the maternal fetal medicine specialist, the perinatologist.
Amazing. Who
do all of our ultrasounds and our consultations for high-risk patients. So some midwifery practices you can't see if you're high risk, if you have hypertension or diabetes or some pre-existing
or if you're an
condition.
older mom.
Right. We have the capability because we are in such close collaboration with our high-risk doctor that we see everybody. Nobody risks out of our practice.
Oh, that's
so
brilliant.
We have the specialists for backup, which I think is the ideal situation, where you have your midwife for your prenatal care and your high-risk specialist for those high-risk situations. Yeah. And we also have OB hospitalists who are 24 hours in hospital with us during labors.
Oh, really?
So at Norwalk Hospital, you have your certified nurse midwife present 24 hours a day. You have your OB/GYN hospitalist present 24 hours a day. And then, anesthesia and neonatology and, everybody's available.
Yeah.
So we really have access to everything we could possibly need. And then,
that just complements the midwifery care. That's amazing.
We provide that low-level intervention until we recognize, okay, well, in this particular case, we need to step it up to those other things. So our practice, you would choose to see the midwives.
Yeah.
There are private midwifery practices that you go and see. There are some practices that have midwives and obstetricians working within the same practice. So you might choose to have a midwife within the OB group, or you might go back and forth between the midwife and the OB, and they may or may not share rotation for births. There are different ways that people do it,
right?
All over the country.
Sarah, do you know if it's covered under insurance to have a midwife? That can all go through your health insurance.
Depends on where you're birthing.
Check that. Definitely check that.
You have to check with your insurance, or check with the practice that you're considering seeing. Our practice, because we are employed by the hospital, accepts all insurance. Anything the hospital takes, our practice takes. It's all processed the same way.
Right.
There are some private independent midwifery practices that might charge like out of pocket, and then you get reimbursed.
Yeah.
A lot of times home birth will charge out of pocket and you get reimbursed.
Right.
So
as Sarah said, check with your provider and then check with your insurance company, because that you don't want to be...
And I would say, if you really have a strong desire to seek midwifery care and you call your insurance and they tell you no, or they're like, I don't know, call the practice themselves and ask, because they have experience, working with that.
Yeah, that's right. I'm sure that's not the first time they've come across something like that. Yeah. One of the questions that Jessica had, which I really liked, was because I feel like it's so relationship driven, the midwifery relationship. Mm-hmm. Do you see the same midwives, or do you get a chance to meet the others? Because obviously, like every time when you go to give birth, sometimes the person that you've seen is there and sometimes they're not. Right. So I think it's nice to know that you can meet a team of people. Is that the same at Norwalk Midwives?
So in our practice, yes, we have a shared model of care. So our goal is for you to see there's 4 of us. Our goal is for you to see all of us during the pregnancy throughout. So you get to know us, we get to know you.
That's brilliant.
Kind of figure out where you're coming from, what your needs are, and that we're not a strange face when you show up in labor. Yeah. Some practices do a caseload model where you'll see the same midwife all the time or the same OB all the time, and then there's shared, care in labor. So you might come across somebody that you're not familiar with, or a private practitioner who may or may not share a call with other people.
We get that. I have to say, we have heard that so many times from mums that have said, oh, I worked with this person all through my pregnancy, right, and then it came to the day and I was like, who are you? Oh, so-and-so's on holiday, or they're playing golf today, whatever it might be. And they're like, oh my God, I've just spent 9 months getting to know this person and trusting you. So I think that's a great model. Well, listen, Sarah, thank you so much. I wish if I had known about you guys, because I only live down the road as well, I wish I would have known about you guys. One more question before I let you go. I had an emergency cesarean. If you had a second or third time mum who had an emergency, or not necessarily an emergency, but a cesarean previously, can they also then seek out midwifery care?
Yes.
For their second they can? So
we provide care for moms who are seeking to do vaginal birth after cesarean. Yeah. And we have a good success rate with that. We actually, one of the things that people don't know about midwives is there are many midwives, including our practice, that do first assist for C-section. So if you were within our practice and for some reason needed a C-section, either planned because you'd had one in the past, or planning a VBAC that for some reason isn't successful, or you have a baby that's breech, or something that comes up during the pregnancy, we continue that care as well. So we have amazing. Our OB hospitalist is the primary surgeon. We do first assist, so we care for you during the C-section, and then we continue to see you afterwards as well.
Oh, that's
so
amazing.
it really is full scope.
Yeah.
care.
Have you watched Call the Midwife?
I love.
Oh my God, it's amazing, isn't it? Jessica and I are obsessed.
Yeah, and I think it's kind of making people recognize midwives are still a thing, and they are in the United States. Not exactly the same as on Call the Midwife, but many things have not changed.
Yeah. Oh, Sarah, thank you so much for being with us today. It was so lovely
pleasure.
to learn more about midwifery care.
Thank you for inviting me.
Thank you. Bye, guys. Have a good day.